Good morning, it's Dr. George here, and today I thought it was probably time to make a video on how to deal with it if you do have a positive rapid antigen test or if you have a positive PCR test for the COVID virus. It's been as predicted, there were a number of events that have all come together that has led to multiple people becoming infected. And mainly that has been family events, as well as parties, as well as community events. Unfortunately for the gay community, we are particularly vulnerable, and that is an actual artifact of the fact that we have less venues. And when you've only got 2 or 3 venues to be able to visit, when people do come together, the chances of the same people mixing, particularly if somebody has been exposed, is significantly higher, and the same group of people will join together frequently, which means that the virus can mix within that group of people. Anyway, that's a small political thing aside. So you've done a you've been feeling a bit, or somebody's told you that you've had an exposure and you've had a positive rapid antigen test. The first thing you need to do is you need to confirm this. Rapid antigen tests can sometimes have a false positive rate. And for this reason, it is vital to go and get a PCR test. Look online and find out what places are open, what places are shut, and get in early. The rapid antigen, the PCR test is important to confirm if you do actually have an infection with coronavirus. If you have a positive PCR test, then you are infected with the coronavirus, and the next parts will follow. Under the Victorian guidelines, you need to stay isolated at home for 7 days. If you live by yourself, this has pluses and minuses. It's easy to isolate, but it's hard to get food. So you can get food deliveries and have them sort of delivered to the door, and then you go and collect them with a mask on. You could get Coles or Woolworths deliveries and get them delivered to the front door, but it is a little bit tricky. But the vast majority of people I know live with other people. So how do you deal with that? It's going to be a tricky juggle of a time, but here's what you need to do. The person who is COVID positive needs to do their best to stay in one room. Let it be the bedroom or something like that. Okay. When you have to use communal spaces, say for example, a bathroom or a kitchen, then it's really important that you do wear the best quality mask that you can have. If you can get an N95 or a P2 mask, that's fantastic. You need to wear that anytime you are outside of your little bubble room. When foods and stuff like that are being delivered, leave them outside the door and then knock and then go away, and then the person inside the room can collect the food. If you have a HEPA filter, this is a great time to use it, and I would have it running as much as you can in your room. All of the people within your household are considered close contacts. For that reason, every other member in the household also needs to isolate. Now, the people in the household need to isolate for 7 days, and they need to do a rapid antigen test every day for 5 days. If they get a positive rapid antigen test, they too need to go and get a PCR test and to isolate as well. If after the 5 rapid antigen tests and 7 days has passed since they've had an exposure, they should be okay to leave the house. But these things change rapidly, so please confirm with your local health services. Any people that you have had close, intimate contact with as well, you would need to speak with them and get them to consider isolating and get them to consider the 5 days of rapid antigen testing as well. During your convalescence, If you start to get severe issues with your lungs, if you're coughing up blood or if you're finding it very, very difficult to breathe, it's very, very important that you seek medical help. Call an ambulance and advise the person on the phone that you are COVID positive. Other things to look out for is if you're unable to get out of bed, if you're not passing urine, or if you're feeling severely unwell, call an ambulance. So when do you get cleared from the virus? So the current guidelines are, if you have had a positive PCR test but no symptoms, that is an asymptomatic infection, you will be clear to leave the isolation after 10 days. If you initially had signs of the infection, in particular issues with the lungs and fevers, but they have resolved, you are allowed to leave the house after 10 days, as long as it has been at least 72 hours, that is 3 days, since the fevers have stopped and your lung symptoms have greatly improved. If you still have symptoms, the isolation is for 14 days, and you're able to leave isolation if you've not had a fever for 3 days or 72 hours, and it's been 72 hours since the lungs have started to improve somewhat. It's a little bit tricky, but there are many guidelines that you can follow, and I will put a link underneath this video for the Victorian guidelines, and I'll try and hunt down the New South Wales, because these are two places where we have very high case prevalence as well. I do recommend that you rest as much as you can. Keep your fluids up. Paracetamol can be useful for helping to bring down the fever, and eat. You may not feel hungry and you probably are going to lose your sense of flavor, but if you can eat as much nutritious food as you can to give your bodies the nutrients to heal, that's very helpful as well. It's going to be a tricky time, and already on Facebook I am seeing multiple people who have been exposed to the virus in one way or another. Even close relatives who really live hermit lives who have managed to get an exposure, and unfortunately Omicron just seems to be able to slip through the cracks. So please stay safe, and if you have a friend who is not doing well, please support them. I urge you, please stay safe. Let's look after each other and let's look out for each other. This is a community disease and it deserves the best community response that we can provide. Look after yourself and stay safe.